Hi, it's Dr. Griebe here from PGS Dentistry in Richmond to talk about surgical extractions. There are a number of reasons why we do extractions on patients. If the cavity is too deep to the point where the cavity is between the roots of the teeth, we cannot save the tooth and the tooth is deemed non-restorable. Also, if there's fractures of the roots of the teeth, we also cannot save the tooth and the tooth will need to be extracted. Sometimes when patients cannot afford to save the tooth by doing a root canal, a crown, and a core, then at that time we may opt to also extract the tooth. So when we perform an extraction, we try to make it as atraumatic as possible, whether that be extracting with forceps or going in surgically with the handpiece to section the tooth to remove it properly. When we go in there to take the tooth out, we always try to start with the forceps and see if we can get the tooth completely removed. If it breaks, we then will have to go in surgically to remove the rest of the roots. When we're preparing to do the extraction, we also want to think about future treatment to replace the tooth. Are we going to do a partial? Are we going to do an implant? If we're doing an implant, we definitely want a bone graft the day of the extraction. When we're healing bone, we're going to lose height and width of the bone. When we don't do a bone graft, we're going to lose a lot more bone, and sometimes we won't be able to place an implant in that area. Also, if we're talking about a top tooth, if it's in the back, we've got the sinus to worry about. If we do not place a bone graft, the sinus could then dip, and then later down the road, if you decide you want an implant, we would have to do a sinus lift or bump. Sometimes it's inevitable and we will have to do a sinus lift or bump for implants. Whenever we do an extraction, we always numb the area with local anesthetic. Some patients with high anxiety prefer to use nitrous gas to also help reduce the pain and discomfort and kind of relax them during the procedure. After the procedure, we do also give antibiotics for any possible infection that's lingering, and/or we definitely give some pain medication to help patients with any post-operative pain. Normal healing pain is just part of the process. So when we extract a tooth, we may run into a complication. For instance, sometimes the bone is fused to the tooth, and when we remove the tooth, the bone is also with it. If it is a bone plate that we need, in this case, we would tell the patient immediately, and then we'd let them know that we need to place a bone graft and a membrane to kind of help the area heal properly. Another type of complication that can occur is a sinus exposure with an upper tooth extraction. If a sinus exposure happens, we let the patient know immediately, and then we may or may not bone graft or place a plug to kind of help that area heal. If healing is not achieved, then we will refer to the oral surgeon. One of the major and most important parts during an extraction and after an extraction is post-op care. Properly taking care of the site at home ensures proper healing and least amount of complications with bone reduction and dry sockets. We highly recommend that you avoid smoking at all costs. That can inhibit your healing process and also cause a dry socket. We avoid heavy exercising, heavy lifting, no straws. All of that can move the blood clot, cause bacteria to go under there, and cause infection.